Hello, good morning, Sitaram, and welcome to another program in this series, Addiction and Recovery. I'm your host, Ram Naresh Dwarika, and this morning I will be speaking on a growing problem that is often overlooked because it does not always fit our traditional image of drug addiction. I want to remind all our brothers and sisters in Trinidad and Tobago, of the Caribbean, and worldwide, wherever you're listening to this program on the various social media platforms, that this program is being recorded and it will be posted soon after its completion this morning on Facebook and YouTube on my channel, Runner Dwarika Addiction and Recovery. And it will also be repeated on radio and TV Jagriti at 9 p.m. tonight. So, those of you who can't stay for the entirety of the program, you can always come back and follow it then. And more importantly, you can send a link from the YouTube or Facebook program to someone who you believe could benefit from the information I'm sharing with you all this morning. So, this morning I'll be talking about a very important and problem that we are actually having that is being overlooked. And this has to do with prescription pill addiction in Trinidad and Tobago. I want to help our listeners understand the problem and also look at some of the solutions. So when many people hear the word addiction, they think of cocaine, marijuana, heroin, alcohol, or crack cocaine. However, one of the fastest growing forms of addiction throughout the world involves medications that are legally prescribed by doctors and purchased from pharmacies. So today's presentation, as I said, entitled Prescription Pill Addiction in Trinidad and Tobago and Possible Solutions. Now, prescription medications have transformed modern medicine. They relieve pain, they reduce anxiety, they improve sleep, they help control attention disorders and help millions of people live productive lives. However, when these medications are misused, overused, or taken without proper medical supervision, they can lead to dependence, addiction, family problems, unemployment, crime, and even death. So, this is a serious matter that we need to pay attention to. Today, I will discuss what is prescription pill addiction, then which prescription medications are commonly abused, why prescription pill addiction develops, some of the warning signs and symptoms, the impact on individuals, families, and society, and the situation in Trinidad and Tobago, of course, prevention strategies, treatment and recovery options that are available to us. And I want to also look at some practical solutions that we can apply in Trinidad and Tobago. Now, let's start with what is prescription pill addiction? Prescription pill addiction occurs when an individual becomes physically or psychologically dependent on medications prescribed by a doctor or obtained illegally. Now, not all, sometimes people buy prescription medicines under the counter. I'm aware of that. So it is important to understand the difference between proper medical use, misuse, dependence, and addiction. They are not the same thing. Misuse means taking medication differently from how it was prescribed. For example, taking higher doses, taking pills more frequently than were prescribed, or using someone else's medication. Now, dependence. Dependence means that the body has adapted to the medication, and stopping suddenly causes withdrawal symptoms. And I am seeing a lot of that, because people develop tolerance with time. So that the same one pill that helped to um, assist with the situation, you know, sometimes it is not working. You have to take more. Now, what is addiction? Addiction involves compulsive use despite harmful consequences. The individual loses control over the medication and continue using it despite problems at home, at work, financially, or medically. Addiction does not discriminate. It affects doctors, teachers, police officers, business people, students, retirees, and even healthcare professionals. And this is something that is not really generally known. But I have worked in the hospitals in Trinidad and Tobago. I have a lot of friends in the helping professions, doctors and nurses that I've worked with. And I know from even alcohol use or illicit drugs use, availability is one of the first reasons people use drugs. And people who work in the hospitals and pharmacies and so on, they have access to this readily available to them. So it is very easy that they may start using, then they start developing tolerance, then misuse steps in, then dependence, and eventually addiction. So that some of the commonly abused prescription medications, just to mention a few, there are three major categories of prescription medications that are commonly abused worldwide and, of course, within the Caribbean. And the first one among them is opioid painkillers. People are suffering with arthritis and all kinds of pain, from injury and strains and that kind of thing. So there's a tendency to be prescribed painkillers. Now, these include medications used to treat pain, such as codeine containing preparations. Codeine is a very powerful pain reliever. Then, of course, there's morphine. Some of you would have heard about morphine. Then there's oxycodone, there's tramadol, there's hydrocodone. All of these are very powerful painkillers. But as I said before, you take it and eventually the body starts to develop tolerance. And there's a tendency for people not to even go back to the doctor who prescribed and discuss it with them, but rather go to the pharmacy and buy it on their own. Now, many individuals begin using these medications following surgery, an accident, or chronic pain conditions. Then there are another group of medications that are abused, and these are especially sedatives and tranquilizers. I am seeing a lot of that in my practice. These include medications used for anxiety and sleep problems, which of course would be drugs like diazepam, alproza, alprazolam, lorazepam, clonazepam. All of these are sedatives and tranquilizers, and these medications are highly effective when used appropriately, but can become habit forming within a short period of time. Then there's another group that people use, stimulants. And these medications are prescribed for conditions such as ADHD, as attention deficit disorder, narcolepsy, and may include drugs like methylphenidate, amphetamine-based medications. And some people misuse stimulants to stay awake and hopefully to improve concentration or enhance academic performance. And I'm aware of this even way back in the 1960s when I was in secondary school. I remember students, colleagues of mine, going to the pharmacy on Coffee Street and buying dexedrine and metivrine and all of those things so they could stay awake. and study for exam. They thought it will give them an advantage. Not realizing when you do these things, it impairs your memory, and then sometimes you wake all night and you can't remember anything the next day. So, why do people become addicted? Let us look at that. There's no single cause of addiction. Prescription pill addiction usually develops because of a combination of factors. There are biological factors that could predispose or precipitate the drug, the addiction, the dependence. And there's a family history sometimes of addiction where children grow up seeing daddy taking a pill, mommy taking a pill, there's the medicine cabinet there, and they see them, and eventually it becomes part of the family culture. And then, of course, because of the brain chemistry, when you take these pills, what it does in the brain, it causes the brain to release dopamine, that is the chemical that makes us feel happy. And then there's, of course, the genetic predisposition. There are people who are genetically predisposed to addiction. And of course, those people who have chronic pain conditions, who develop tolerance and need to continue to take the drug. Sorry. Then there's psychological factors. Those were biological. These are psychological factors like depression, anxiety, trauma, stress, low self-esteem, and unresolved grief, the loss of a loved one and all of that. People might have been introduced to it initially and then develop dependence. Then there's social factors. That is peer influence. You know, People working in the fraternities, oh, look, they slip you a sleeping pill or a tranquilizer. As I said before, people who work in hospitals and have easy access to medication, but not only people who work in hospitals, family members who have access to the medicine cabinet, sometimes taking somebody else's medication. Now, what can perpetuate these things is things like unemployment and social isolation. You started using it out of curiosity, or you were prescribed it. Usually, it is you were prescribed it, but you remember the effect it had, and now you find yourself unemployed, stressed out, whatever, isolated, divorced, separated, and you go back to it, and you start using it to help you to cope. And then, of course, there are cultural factors. Many people believe that if a medication comes from a doctor or a pharmacy, it must be safe. I mean, I didn't buy it out of the streets. I'm not a piper. But that is not so. This is a misconception and has contributed significantly to prescription pill abuse. Because these little innocent looking pills, they're very powerful. They can do much more than a drink or a smoke. So I often tell people, look, legal does not always mean harmless, you know. Now let us look at the pathway to addiction. Prescription pill addiction is often described as a gradual process. It may begin with a back injury, dental surgery sometimes, insomnia, anxiety, or emotional distress like the loss of a loved one, and bereavement and grief and so on. Initially, the medication provides relief. However, soon the individual notices that one pill is no longer enough. The body is starting to develop tolerance. So you start going to higher doses are needed. And then the medication is taken more frequently. So you're taking more of it and more frequently. The pills are obtained from multiple doctors. What a lot of people do, they start shopping around. They go to several, this doctor doesn't know what the other doctor doing. And you go to this one and you get some. You go to the other doctor and you get some. And medication is purchased also under the counter, as I said, illegally, where the person is able to get because of contacts. And in Trinidad, everybody has a friend who could get things done. So eventually, life begins revolving around obtaining and using the pills. And I've had the experience of having a patient here who had two other people that he was giving, financial commission as though it were, to go around to different pharmacies and buy psychotropic drugs for him. I don't want to mention which one. And they were able to get it because I know some unscrupulous pharmacies, it's a business and they will sell you it on the side. So eventually, life begins revolving around obtaining and using the pills, just like the alcoholic or the cocaine addict. When you're not using, you are thinking about it all the time. So, some of the warning signs of prescription pill addiction, what family members need to look out for these telltale signs. One is excessive sleepiness. You know, I mean, this young man, and all of a sudden sleeping long hours. You know, yeah, I know young children in their formative years will need a lot more sleep and can sleep at the drop of a pin. But you need to look at if there's excessive sleepiness, even when they're supposed to be awake. Then there's slurred speech. And this is not only for young people, this for anyone who has now been abusing or becoming addicted to prescription pills. Then sometimes it can also lead to poor coordination, losing the balance and all of that, drifting and all of that. Then weight changes. There's some drugs that can make you start putting on weight or losing weight, like the stimulants can make you lose weight, while the ones for depression and all that could make you start putting on weight. Then, of course, dizziness. You know, you can see when they get up and so on. And this is not to, these are just warning signs. In themselves, they're not conclusive evidence because person with hypertension and all of that can experience dizziness as well. And then, but with psychotropic drugs, you can have memory problems where they're having trouble now to remember what they had to eat yesterday, you know, and then frequent complaints of pain so that they can justify buying the drug, having the drug, and using the drug because they become physically addicted. Then there are behavioral signs where they go doctor shopping. I mentioned that earlier on. You know, family members will notice in the conversations, you know, I don't like what this doctor doing. I think I need to see somebody else, and they see somebody else. And then family members may also notice that, medicine from the medicine cabinet missing or being depleted more rapidly than they are aware of. And then there's secretive behavior. I know of patients of mine and other people that came to my attention where now it is very easy to hide these little pills. It is more difficult to hide a bottle of rum or your drug using paraphernalia. But this one, you can hide it all about. I don't want to say where, but people who have become dependent are very, very innovative. And then what you can actually see is mood swings. Person sometimes euphoric and the next minute they're in the dumps. They're peaceful sometimes and sometimes they're highly irritable. You can't have a conversation with them. Then you can also notice their declining work performance where can't go to work, sleeping too late, you know, losing the ambition to go to work. So, of course, in the end, these would lead to financial difficulties and social withdrawal, where they start isolating because they might lose their job now, have nothing to do all day, just go and take the pills and sleep. And then, of course, there's emotional signs that I referred to some of them earlier on, like irritability, depression, anxiety. anger, and loss of motivation. Now, many families recognize the problem only when a crisis occurs. You've seen it happening all the time, right in front of you, your eyes, but don't realize what the person is doing until they lose their job or some crisis, or they start hallucinating and so on all of a sudden, and then you get to realize that, look, there was something else going on here. Now, the impact on families, pres- prescription pill addiction affects the entire family. Family members may experience fear from a person who is always angry, irritable, or shame because of what is happening with that member of the family. Financial hardship as well, as a result of loss of employment or excessive buying, having to support the addiction now. Emotional exhaustion, where you're talking to the person, and I have a few patients. I had a patient who was a professional, whose parent, a single mother living in the same house, was always stressed out because this person will continually lose the job, be suspended, because they will go out on binges of using the prescription pill. And I dare say a lot of people supplement the prescription pill with now alcohol and other drugs. Of course, this would lead to, when you're in a relationship, marital conflict and a loss of trust. Because for a lot of people to continue to keep their habits secret, they have to tell lies. And for those who might have promised to stop using and didn't, it erodes the trust in the relationships. So that children living in homes affected by addiction may experience anxiety. They may present with academic difficulties, behavioral problems, and the increased risk of developing addiction later on in their own life. I've heard so many people speak about how they suffered because of their parents' addiction, whether it was to prescription pill or very often in the case of alcoholism or other drug addiction, cocaine and marijuana. And they swore to themselves that they will never ever use those drugs because of what they went through, only to find that they themselves went on to use it later on, because we know now that there's a genetic predisposition to addiction, whether it be legal or illegal drugs, and that not only genetic, but children learn what they live, what they experience. Remembering they seeing mommy or daddy every evening, going to the medicine cabinet, taking something, and they talk about it, and the parents don't even keep it a secret, and sometimes they even give it to their children, some of them, if the child is having trouble to sleep or something like that, a young man or somebody, a relative or a sibling. Well, here, take one of this will help you. And it becomes part of the common culture of the family. They talk about it around, maybe you should get on this and take some of that, or take that, or take that. I taking this, it's working for me. And that's the conversation, not only in the house, but sometime in the community, in the chat groups and so on. Now that we have all of these social media connections, Facebook and WhatsApp and so on, people are cross prescribing to each other and so on. Look, girl, I had this problem and I've been taking this, for my stomach and for my, and people rather than pay the money and go and see a specialist or a doctor, get proper advice, they just decide to go. Or sometimes they even, you know, people share their medication. These are all very dangerous things. So that there are health consequences as a result of these things. Long term misuse of prescription medications can lead to liver damage. Let me speak a little bit about that. The liver is like the customs department in the country. anything that has to come in the country must pass through customs. So too, the liver, anything that enters the stomach, has to be examined by the liver, and the liver will decide whether this is good for the body or not. And the liver is aware of things that are natural and good, but most prescription pills are synthetic. It is not known to the liver. We weren't born with those things in our system. If it didn't come from some plant or animal food or something like that, that is good for us, that is not toxic, the liver immediately is going to try to neutralize it. But what happens? There's something called a half-life. Some of you might have heard about this, where the liver could only probably neutralize 2 milligrams of a certain medicine, and the big pharma manufacturing companies who have done the research knows that, look, um, the liver could only neutralize 2 milligrams of this medication. So they suggest that the doctors or whoever prescribe 10 milligrams. So while the liver is struggling to neutralize 2 milligrams, 8 milligrams get past the liver into the system. And now we also have another system where we give injections. It's like jumping through the window. You're not coming through the front door anymore. So the liver don't even know that some medication entered the body. Now, as I said at the beginning of the program, there's a good use for this. But having worked in all the hospitals, I'm not a doctor. Let me say this up front, right? But I've worked in the hospitals as a social worker for many years. And I have not, in my own knowledge, been able to come to terms with the fact that I don't know of any doctor who knows exactly how many milligrams of any medication that John Brown should take as opposed to someone else. Everybody either get 2, 5, 10 milligrams, how they are made and packaged. And I know from personal knowledge that the 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 medical sales representatives and so on, I've heard them at presentations, having people present, to doctors and professionals that, look, if 10 milligrams will mitigate the pain, just to make assurances doubly sure, give them 20. And we also know that all of these medications have side effects, some of which we know and some we don't. And if you really read the leaflet that comes, even with these simple paracetamol and all of that, so those could be fatal if misused. And even when you use it as prescribed, there are side effects. Sometimes you wonder if the side effects are much more serious than the condition for which you were using it. So this excessive medication, of course, is going to take its toll on the liver. It will also take its toll on the kidneys. You have liver damage, you have kidney diseases, you'll have heart problems as well, respiratory depression, there's memory impairment, increased risk of accidents, people under the influence. You take the tablet, now you're feeling good right now, but half an hour when the body really starts to process it, you start to feel sleepy, and you don't know when the eye shut. You're driving the car and you drop asleep. And then, of course, those people, I have seen a lot of people in recent times, young people in the upper and middle class, suffer with a little depression because of being jilted, or anxiety because they can't keep up with their assignments because of their very, very busy lifestyle, the socializing and the media addiction and all of that. I spoke about those already. And now getting anxious, so they go to see a psychiatrist, and he'll give them an anti-anxiolytic or a sedative, and they'll take it, and it will work for a little while. But then eventually your body starts to develop tolerance, so you have to use more, and you have to use it more often. And you very well can't go by the psychiatrist every so often to get a new prescription for higher doses and all of that. And a lot of people who were introduced to alcohol and other drugs find that they could use the other drugs now to supplement the prescription pill. And that is deadly. That is why some people overdose and drop down dead, because the people who prepared the medication, who manufactured it, the pharma, the big pharma industry, they never tested it in conjunction with these other drugs, with alcohol or marijuana or cocaine. So that mixing medications with alcohol is particularly dangerous, because alcohol is a sedative, and if you are already taking a sedative, sleeping pills, and you're taking them in conjunction, you can not only put your brain to sleep, you can put your heart to sleep. And anytime your heart drops asleep, you're dead. So many overdose deaths occur because individuals combine sleeping pills, anti-anxiety medications with alcohol and painkillers. And this combination, sometimes they take in all four: the sleeping pills, the anti-anxiety medication, the alcohol, and the painkillers. And you don't know how these work in tandem with each other. So that this combination can suppress breathing and become fatal. Prescription pill addiction in Trinidad and Tobago. Let's talk about our local situation. Although comprehensive national data remain limited, healthcare professionals and treatment providers in Trinidad and Tobago have observed increasing concerns regarding tramadol use, codeine containing medications, sedative dependence, polydrug use involving alcohol and prescription medications. Now, I am at the front line. I see this almost daily. People are coming to me now because they've become dependent on the sleeping pills, and they have developed tolerance. So that, but if they take any more, they are going to trip over into overdose or start hallucinating in withdrawal, and they need to come off the drugs. But if you go back to your doctor, in Trinidad, unfortunately, we do not have drug treatments centers that deal with prescription pill addiction. None of the hospitals. This is something, if you really have to treat with it, you will have to wean the person off gradually. And it means months in an environment where you are being supervised during that weaning process. We don't have that facility in Trinidad. People can't even afford it. They are privately. I don't know. I've not seen it. And this is one of the reasons I introduced the use of acupuncture, because you can use acupuncture to deal with the withdrawal symptoms from these prescription pill addiction, these medications. You can also use acupuncture to treat pain. So now, not only in Trinidad and Tobago, regional and international trends suggest that prescription medication misuse continues to be a significant public health problem everywhere in the world where it is available. So, in that way, I'm thinking, as I said, that some places where it is not available, people are still using natural methods. And, in my practice here, I am now a lot of time spending a lot of time counseling my patients, helping them to go back to natural methods of sleeping and dealing with other health problems. And medication, to my mind and my opinion, should only be used in crisis, in emergency. But people should not have to live on medication for the rest of their life. As I say that, diabetes and hypertension have become chronic illnesses in Trinidad and Tobago. But these are not caused by viruses or bacteria. These are lifestyle illnesses. And if you correct your lifestyle, you can correct these conditions. More on that maybe later on. So we are seeing, in many cases, individuals never imagined that they would become addicted when they were first prescribed these pills. I mean, that we trust our doctors and pharmacists, and yes. But as I say this, I know that a lot of general practitioners, and this is not being critical, but it's to be realistic, because up to 2 days ago, I saw a patient who was prescribed psychotropic drugs by a general practitioner. Now, this is the psychotropic drugs really is the domain of the psychiatrists. They are really the ones who are ethically responsible for prescribing these psychotropic sleeping pills and anti-anxiolytics and so on. And people with those conditions should really be referred to the appropriate professionals. However, in Trinidad and Tobago, a lot of people are not even, they hear from a friend and they just go and buy the medication and take it, not realizing how serious this could be. So that very often I hear people say, well, it started with a prescription from my doctor, right? And sometimes you're told, well, this is not addictive, you know, but sometimes people split hairs between dependence and addiction, and tell you, well, you will not become addicted. But the truth is, people can become addicted to even behaviors, because addiction is not only physical or biological, it is also psychological, so that people can get addicted to behaviors as well. So one has to be very, very careful, that you start taking this. And as I say that, any medical professional, in my opinion, if you put a person on a psychotropic drug that has the potential of becoming addictive, you need to work out a strategy plan with that person. You need to educate them of the consequences, because we know in Trinidad, every doctor here should know that there's always that potential for the patient to abuse the drug and to become dependent. So sometimes, after they get the prescription, others may obtain the medications through friends. And I know that when I work in the hospitals, a lot of people, that's the reality. A lot of people have friends working in the hospital who will just go and get a file number from a file and go and get a doctor, a friend of theirs, to just sign the prescription, and they'll go and collect the medicine from the pharmacy. And it is no surprise why a lot of medications are not available in the pharmacy, because they're being, you know, prescribed out. I won't go further to say that I'm aware of other abuses that needs to be investigated in our health institutions. I have heard of instances where even equipment has been found in some people's private practices and so on. Very expensive equipment found in nursing homes and all of that. So that, coming back, some people get it from family members, that is, reading the medicine cabinet. And of course, illegal sales, where you're not supposed to sell these prescription medication without a prescription, but some people do it. And then some people are buying these things online. Online, they paint medicines and all of those. And of course, as I mentioned before, sharing your medication with other friends and so on. Now, the challenge is that prescription pill addiction remains largely hidden. People don't get drunk and fall alongside the road or get arrested for using prescription pills and all of that. And this is why it has remained underground and very quiet and hush hush in Trinidad and Tobago and worldwide. So unlike alcohol misuse, there's no smell. You wouldn't, pick it up whether somebody is using the drug. And unlike illicit drugs, there may be no obvious paraphernalia. And these little tablets can be hidden in so many different places. I don't want to give people ideas out there, but I know of this. And people have a supply, they have the regular supply, and then they have a backup to that supply, and then they have a backup to the backup. And sometimes they forget where they leave the medication. And even when they come to see me and they're trying to get off the drugs, then start discovering by sheer accident, weeks and months after, that look, Wow, look, there's a little packet of tablet here. You understand? And that could lead them to relapse. So people can maintain jobs and responsibilities for years while silently struggling with prescription pill addiction because it doesn't show. You know, they might be dizzy and you think it's the high blood pressure, or they might present others, I'm just tired from the weekend, or all kinds of things like that. And if you start hallucinating, well, somebody put a spirit on them or something, somebody did obia and nobody's taking responsibility at any stage. So there are some myths about prescription medication. I want to touch on those because, time is always running out when we're doing this program. So let us address some of these myths that exist. Myth number one, if my doctor prescribe it, it cannot be addictive. That's not true. That is false. Myth number two, prescription medications are safer than street drugs. Not necessarily. These prescription medications sometimes, well, they're more potent and they're calculated. When you take one, by the time you take two, three, you start developing a dependence. You can't just stop it suddenly. Then number three is people tell themselves, I can stop whenever I want. And they do to convince themselves and then go right back to it. Addiction affects judgment and self control and can be very cunning, baffling, and powerful. Then another myth is that only weak people become addicted. That's not true at all. Addiction is a medical, psychological, and social condition, and anyone can become, if you start using it, you can become dependent and addicted. Then there's another myth, and this is that withdrawal is just a matter of willpower. Nonsense. I can tell you from personal experience, you know, I thought I had the strongest willpower in the world. I wasn't addicted to prescription pills, but I was addicted to alcohol and couldn't stop because of the withdrawal symptoms when you're not using it. Withdrawal can be severe, especially with prescription pill addiction, and in some cases, medically dangerous. Some people, if they stop some drugs, suddenly it can be very, very serious, especially these steroids and all of that that you get prescribed. If you have to take a certain range of it. There's a formula. You take seven, and then you take six, and then five, and if you stop suddenly, you develop another illness that is more serious than your Bell's palsy or whatever you were taking the drug for. Now, withdrawal symptoms vary depending on the medication and the strength of it and the frequency with which you take it. But common symptoms of withdrawal will present as sweating, tremors, nausea, insomnia, anxiety, muscle pain, depression, panic attacks, and cravings. Now, let me say this. Very often, if you review the list I just presented, you'll notice most people take it for insomnia or anxiety or muscle pain or depression or panic attacks. But when it is wearing away, that is exactly what happens. It's like you're on a merry-go-round, You take it to feel better and then you become more sick. And that is the cycle of addiction. Now you can't jump off this merry-go-round. You're going too fast now. And this is why I decided on this particular private practice that I have, where I use acupuncture. You kind of get addicted to acupuncture. Some individuals experience severe withdrawal requiring medical supervision, where they start hallucinating and becoming psychotic and all of that. So some this is why sudden discontinuation without professional advice is not recommended. Now, quickly before we run out of time, prevention strategies. Prevention begins at home. For individuals, you take your medications exactly as it is prescribed. Never share medications. Read the warning labels so you know what you're taking, and sometimes some medication are not compatible with others. You might be taking a diabetes medication with a hypertension medication, and in combination, they're really damaging your kidney. And I have seen people that I know closely who suffered kidney damage and are now deceased because of the same problem. You also need to ask questions before you start treatment. Talk to your doctor. I know, and this is something I'm concerned about because I know a lot of doctors. You have a whole waiting room full of patients, who waiting since morning, and you have to spend a lot of time if you're going to do a full evaluation, and and you don't get to spend enough time with the patient to really talk to them and hear what happened and give them answers as well. And I know a lot of people who are afraid to ask the doctors questions because he might get upset with me. I find I'm asking too many questions. Please, you need to. I encourage all my patients. Let's talk. Let's talk. Tell me about what's happening. And of course, dispose of unused medications safely because, children sometimes can go and take it as well. Now, for parents, monitor medications at home. Every bottle have the contents will tell you how many tablets you're supposed to have there, date of expiry, and you'll have an idea how much you took and how much you didn't take. So educate your children about prescription drug risks, keep medications secured, and lead by example. If you take in medication, let your children know that this is not to be taken for the rest of your life. Now, for schools, should include education on substance abuse, mental health, healthy coping skills, and decision making. For healthcare professionals, they need to monitor prescribing practices and have an exit plan when you prescribe drugs that can possibly cause dependence. Screen patients for addiction risk. There's some people who might already be addicted to other substances like alcohol. Educate your patients. Encourage follow-up appointments, you know. And for pharmacists are often the last healthcare professional to see the patient before medication is used. They play an important role in providing education, identifying suspicious patterns, and use of medication, encourage safe medication practices. Now, in Trinidad, as I mentioned before, we do not have too many treatment options for prescription pill addiction. It is something that we need to look at because it is almost epidemic proportions here. Recovery is possible, and treatment may include, of course, medical detoxification. This helps individuals withdraw safely under medical supervision. Now, it's people like me who get to see this more often because you go back to the doctor, you just get a repeat. You go to the clinic, the public clinics, you get a repeat. You don't have really much time to talk to the patients there. Of course, individual counseling, group therapy, and family therapy could help in situations like this. We need to have rehabilitation, residential programs, and outpatient programs for individuals who have become addicted. They need to be taught relapse prevention and healthy coping mechanisms. And of course, support groups like AA and so on, such as the 12-step programs can help. Fellowship, accountability, it can give hope and continued support. Then there's, of course, mental health treatment that will address depression and anxiety and trauma. But these, of course, need to be uh, closely supervised. Treating these conditions significantly improves recovery outcomes. Relapse prevention strategies include avoiding triggers, building support systems, maintaining healthy routines, exercising regularly, managing stress, attending support group meetings, and seeking help early. I'm going to go through this quickly because we have 5 minutes again. Relapse should not be viewed as failure. Instead, it should be viewed as an indication that additional support is needed. Now, national solutions for Trinidad and Tobago If we are serious about addressing prescription pill addiction, several national initiatives should be considered. Public education campaigns, like what I'm doing here, television, radio, social media, schools, and community organizations can be used. Improved data collection. In Trinidad and Tobago, we really do not have proper statistics when it comes to prescription pill addiction because so far it has been kept underground. We need to know what is the situation with prescription drug misuse, overdose incidents, treatment outcomes, and then we have to strengthen treatment services in Trinidad and Tobago. We also have to train our healthcare professionals. Doctors, nurses, pharmacists, and counselors should receive ongoing training on addiction, safe prescribing, and early intervention. There need to be a greater collaboration between the NGOs, religious organizations, and schools and communities need to work together if we're going to be able to deal with this. Addiction cannot be solved by one institution alone. A message to families. If someone you love is struggling with prescription pill addiction, do not ignore the problem. Do not enable the behavior. Do not lose hope and do not cover up for them. Encourage professional help and remember addiction is treatable. People do recover every day. So, a message to those who are struggling, if you are listening to this program or watching today and find yourself dependent on prescription medication, I want you to know that seeking help is not a sign of weakness. It is a sign of courage. You are not alone. Recovery is possible, and your life can improve. Your family can heal. Your future can be brighter. Prescription pill addiction is one of the hidden epidemics of our time. It affects people from every community, every profession, and every socioeconomic background. The good news is that addiction is preventable, treatable, and recoverable. As a nation, Trinidad and Tobago must continue promoting education, prevention, early intervention, treatment, and recovery support. Each of us has a role to play. Parents must educate, healthcare professionals must prescribe responsibly, communities must support recovery. And those struggling with addiction must know that help is available. So I want to leave you with this thought. Prescription medication can save lives when used properly, but when misused, they can quietly take away our health, our relationships, and our future. So let us choose education over ignorance, compassion over judgment, and recovery over despair. So I want to thank you all for listening and viewing today. And remember, this is going to be posted on YouTube and Facebook at the end. You can view it there. And it will also be repeated on radio and TV Jagriti at 9 p.m. tonight. I want to thank the staff at Radio and TV Jagriti, the CEO, and all of them for helping and in promoting and educating our brothers and sisters on all of these topics relating to addiction. And of course, as usual, I'm your host, Ramnaresh Dwarika, wishing you and your families good health, hope, and recovery until next week, Thursday. So bye for now.